Hi, my name's Kate, and today we're going to be talking about something that tends to make people a little uncomfortable, and that's cancer. We're going to be talking about two different types of cancers, both that manifest the skin. One is skin cancer, or melanoma. The other is a T-cell lymphoma that affects your white blood cells. The reason that we're including this with skin cancer, though, is because all of its early symptoms will manifest through your skin in the form of growths, rashes, things of that nature. So to begin with, what is cancer? Cancer is an overgrowth of healthy human cells, and that's why it's so hard to detect, to treat, and why there's no cure. It's not a virus or a bug or an infection. It's our cells growing out of control too quickly or not dying after the 7 cell divisions that every other cell gets. So they stick around and there's too many cells in one area, and that's when you get those masses and those lumps. So today we're going to be talking about skin cancer and cutaneous T-cell lymphoma. Basal cell melanoma is your typical skin cancer that is the easiest to treat. I don't know if you've ever seen anyone, usually in the elderly, who have like these black, like scaly, scabby looking things on their skin. That's basal cell melanoma. When people tell you to, check your moles, keep an eye on them, make sure that they look normal, that they're not changing, it's melanoma. Melanoma is caused primarily by overexposure to UV rays. So the sun. The worst thing you can do for your skin is to go to a tanning bed. It's absolutely terrible, and it greatly increases your risk of skin cancer. So just wear some sunscreen. Other ways are chemicals, being exposed to different chemicals, things like that. But usually the person has a long-term history of excessive sun exposure. So that's why you'll hear a lot of companies and a lot of people saying you got to wear sunscreen, watch out for the wrinkles, watch your moles. You got to be really aware of what's going on in your body. Cutaneous T-cell lymphoma, and cutaneous meaning of the skin, is a very silent killer. It's most likely misdiagnosed in almost all patients, and that's really a shame. Most general practice doctors are not as aware of it as they should be. They're not as educated on it, and usually misdiagnose it as a rash or a cyst or something like that. And I do have a picture I'm going to show you. It does kind of look like a rash or a sunburn. And sometimes people can be misdiagnosed for years as this slow growing cancer just propagates within their body and makes things worse and worse. If you're able to catch T-cell lymphoma in its early stages, in stage 1 or 2, you have a really good chance of survival. Your chance of survival is about 85%, which isn't bad. I mean, it's not amazing, but it's not bad. If you are misdiagnosed, as most people are, the average person with this disease is misdiagnosed for about 10 years, 6 to 10 years. You're not going to catch it in stage 1 or 2. Unfortunately, you're probably going to find it in a late stage 3 or stage 4. By then, the chance of survival at 1 year is only 7%. So you're going from 85% if detected early to less than 10% if it's misdiagnosed. And that's the purpose of this video. Give you examples of things that aren't normal so that you can be your best advocate when it comes to your own health. It may be a growth or it may not, but it's really important that you don't ever let any doctor or nurse or anyone really tell you you're crazy and that it's in your head or it's something that it's not. It's always perfectly acceptable to get a second opinion. So there's 2 types of T-cell lymphoma. One is called mycosis fungoides, and it does cause fungus-like growths on the skin sometimes. And the other is called Sézary syndrome. And Sézary syndrome is very, very rare, but also very deadly. So I'm going to show you a picture now of a person who came in after being misdiagnosed a few times, just having a rash or severe dermatitis, and it turned out that they in fact had this autoimmune disease, this T-cell lymphoma. So this is their stomach. And yes, you can see they do have these characteristic kind of growths that you might see in a skin cancer. But they don't go away. So they do kind of look like maybe like a bad acne scab that is picked at, but they're not going to heal. Neosporin is not going to do anything. Topical steroids might make them go away for a little bit, but what I really want you to focus on, because this is ugly, people are going to go to the doctor for this. This is hard to dismiss. But really what you need to focus on is this red area. This is just a rash. It's scaly, it's itchy, comfortable, but to most people and to a lot of general practice doctors, it's a rash. And for most people that present that type of redness, it probably is a rash, but not in this case. Most general practice doctors, again, not all, will prescribe you a steroidal cream or tell you that you have eczema or dermatitis, things like that, and they'll send you home with something topical to put on the skin. They'll do it for a week, 10 days, and it'll go away. And then a month or so down the line, it'll come back. And it'll look similar, and it'll itch similar, and it'll feel similar. This is when you need to stop and think. Unless there's some sort of other reason that this might be happening, maybe you have ringworm, maybe you have athlete's foot, you work out a lot and get really sweaty. If there's not other reasons why this might be happening that you could environmentally change in order to rule out, you need to get a second opinion. Some doctors are dismissive and some are excellent, but you need to not rely 100% on them. You need to trust your gut. You don't want to end up 10 years misdiagnosed with a 7% chance of survival. People who are misdiagnosed and therefore are in stage 4 usually only last about 6.5 months after they're diagnosed. So although it seems fast and lightning to the families that are affected by it, it's actually really slow growing cancer. Like I had said earlier, studies show that people are misdiagnosed from about 6 to 10 years on average before they really notice symptoms that get them checked well. So the cancer is with you a very long time before other parts of your body start to be affected. It's also autoimmune disease, so you're going to get a slow decline in your immune system and all the negative things that happen with that, be more susceptible to illness and the like. So what are the treatments for basal cell melanoma and for T-cell lymphoma? Well, basal cell melanoma, it's going to be cut out, like immediately. Cut out, tested, hopefully it hasn't spread. They may do some diagnostic testings now to make sure it's not in any lymph nodes. And if it's not, you'll probably do radiation, to get the area around it, some topical treatments, steroids, and then you'll probably be checked every 6 months in a skin exam with a dermatologist. T-cell lymphoma, stage 1 and 2 is pretty similar. You can't cut it out. It's in your bloodstream. There's no getting rid of it as far as removal, but you will get topical steroids for the physical affected rash and things like that. And then you'll start doing radiation and phototherapy. So they'll try to target the skin where it physically is manifesting, and also deeper parts of the body like the bloodstream or the bone marrow where it grows. Now, if that doesn't work, or if you're misdiagnosed and you move into the later stages, that's when the treatment gets much more severe. And that's when you're going to get things like the chemical chemotherapy that we all know, where you lose your hair and you're very ill. The problem with this is it absolutely destroys your immune system. So you're already losing your white blood cells because they're cancerous. So you're already immunocompromised. And then chemical chemotherapy on top of that will wipe you out anyways. So it's not the favorite and it's not ideal, but it is still used because sometimes we just don't have a better alternative yet. This is a very underfunded and understudied type of cancer, and we don't even know really what causes it definitively, though there are some guesses. So you'll do sometimes chemical chemotherapy if your body can handle it. You'll do immunotherapy and genetic therapy, where they'll actually go in and a lot of this is sterile experimental. They'll change one or two genes in the cancer cells so that your immune system can see them as cancerous and destroy them on their own, things like that of that nature. And one of the not so successful but kind of Hail Mary treatments is they'll do a total stem cell transplant of your long bones. So the whole bone marrow will go. They'll remove all the affected bone marrow and you'll get a stem cell transplant. Unfortunately, that doesn't really work as well as they would like. Sometimes it works for people, but most times it doesn't. You really can't depend on it. They're having more luck with immunotherapy and the genetic therapy than they are with stem cell transfusions. So unfortunately, there is no removing it. There's no getting rid of it. You have to find a healthier way to have your body fight it. And that's where we're struggling. So what causes it though? They find that it occurs more so in men, ages 55 or older. And they don't know why. And there are some studies that show, though non-conclusively, that men who have been exposed to chemicals in different agricultural areas tend to have a higher chance of T-cell lymphoma. And there is a chemical called Agent Orange, which was used in the Vietnam War and the Korean War, which unfortunately seeped through the soil into the water and the men drank it, that some people are calling as one of the main contributors to these genetic mutations that cause this issue in the first place. That might be why it's more common in men of a certain age group, because in that time period, men were the ones who went to war. But again, nothing conclusive yet. There's no suntan bed that you can avoid in order to guarantee you don't get this. And that's why it's so scary. So it really is a silent killer, and you really have to be aware of your own body. Sézary syndrome is much more dramatic. The dermatological symptoms are not rashes. They are full-scale peeling of your body. It's very painful and very, I do have a picture. It's not the best picture, and I'm running out of time, but I did want to show you what Sézary syndrome looks like. And people do go to the doctor for this and are not misdiagnosed because it is so severe. This is an example of a patient's hands, and I know the picture is really bad, but as you can see, this person is having major peeling of their skin in an almost severe sunburn-like way, but it doesn't stop. And it's very painful, and you swell, and it's very unenjoyable. So, like basal cell melanoma, people will go to the doctor and they will get tested adequately and diagnosed appropriately. The problem is that by the time you have Sézary syndrome, your chance of survival is really not good. It's about 3.5%. So in conclusion, although there's much more information we could talk about for an hour, the point of this video is not to scare you or to bore you or to put you through a science class. It's really to show you how many mistakes doctors can make. And misdiagnosing someone for 6, 7, 8, 9 years is a mistake. It's not a negligent mistake. They didn't do it on purpose, but it's a mistake. You have to be your own advocate. You have to feel comfortable standing up for yourself and your family and to your doctors. If you have repeat issues, make sure you see specialists. and it's always okay to get a second opinion or a third opinion or a fourth opinion. Don't let anyone tell you you're crazy. Thank you.